All right, it looks like we're live now. Let's go ahead and call this joint session to order. We have a joint committee session this afternoon to get an update on the county's health and wellness program. This is a joint committee session between Health and Human Services and our Government Operations Committee. If we could please invite Ms. Karen Plachinsky and Ms. Liliana Rojas to the dais, and anybody else who will be speaking to this wonderful initiative. Thank you so much for coming forward. The health and wellness of our county employees and our county residents is paramount. It has so many productive and important qualities. I've had the opportunity to participate personally. In fact, a video that I did with the county executive doing the Cupid dance, I believe, went viral. That's right, as part of this wonderful initiative, which I've got lots of comments about and lots of kudos from my kids. So that was great. But why don't we go ahead and get this session started? If you could please introduce yourselves, and if we could jump right into the presentation.
Good afternoon. Thank you very much. I'm Karen Plachinsky, Acting Director of Human Resources.
And good afternoon, I'm Lily Rojas, I'm the Wellness Program Manager.
And thank you very much for this opportunity. Chairs, thank you. Council members, thank you for this opportunity to talk about what we've been doing with our wellness program. I'll start off and then I'll turn it over to my expert, who is the program manager and really is the genius of everything that we're doing. So Live Well is a joint labor management employee wellness program. Our mission is to cultivate a culture of well-being through holistic program and resources and policies that empower our employees to lead a healthier lifestyle. Our programs are for the insurers, employees, and their families, and we are in the midst of negotiating for FOP as well, so we do hope to bring them on this fiscal year as well. Our wellness is really centered around, as you can see, seven areas. It's not just focusing on fitness, but we're also focusing on emotional, financial, intelligence, physical, occupational, social, and spiritual. All 7 of these things really combine a well-rounded person, and we focus on all of those throughout the year. Our foundation for success and what has really gotten us to where we are today is the leadership support at all levels throughout the organization. As Gabe mentioned, he was part of a Cupid dance, and we've done a number of things throughout the year to pull leadership in and support. Communication, we brand everything that we're doing. We take our program and marketing, our resources, and take it out to employees instead of having employees come to us. And the incentives, we reward for healthier behavior so that we're really encouraging people to look and do things differently as they move through the program. We could not do this without our ambassadors. We have 80 ambassadors throughout the county government. They are our life to the program. They do coordinate. We put a bulletin board up on our SharePoint drive to give them an opportunity to do things specifically for their department, to get them engaged as well. And we have some really magnificent champions throughout the county government. Our goals, each year we establish some goals. Sorry. There we go. Our goals for this year really is focusing on mental health. As a nation, I think everyone's been focusing on mental health. We want to do some prevention guidance and look at the stigma that's associated with mental health. We're really collaborating with a number of our stakeholders, public safety agencies, 311, 911, animal services. We're taking programs out to our very high-stress employee population, highway services, bus operators, and we're really trying to target those employees and really develop programs that specifically meet their needs. This year, we're actually working with risk management and occupational medical to look at reducing injuries and workers' compensation. We've started the kickoff meeting this year with occupational medical and risk management to really put some focus in on where those injuries are and what we can do as a Live Well organization, the wellness program, to help bring those costs down as well. The new Sitting is the New Smoking campaign, and we are really focusing this year on that campaign. We have teamed with one of our carriers to provide a program for folks that they can look at right at their desk to do some exercises to keep the body moving. And we kicked that off March 1st, if I'm not mistaken. And then we're also really looking at social wellness as part of mental health as well, having the connection, the social connection with coworkers or family members so that you really have an opportunity to talk with someone. And then we're also really looking at how we can reduce our health costs as well, working with our carriers and our consultant, our health and wellness consultant, to look at the various data and how do we get a return on investment for what we're doing. We couldn't do everything that we're doing today without our carriers, Care First, Kaiser, and United Healthcare. We have credits that they give us in order for us to be able to do our education programs, our disease management, our diabetes programs. They also help with the special events and providing resources for us for that, as well as health screenings and promotional material. All of those come through each of the carriers, which help us provide a better program for our employees. And I'm going to turn it now over to Lily, and she's going to kind of walk you through everything that we're doing programmatic-wise.
So thank you, Karen. We wanted to give you an overview of what the year was like for Live Well 2018 as far as the accomplishments that we had, and especially all the disease management programs that we ran throughout the year. So we estimated about 139 total events throughout the county. Those were presented at various locations for various departments. So we try to hit different shifts, we try to hit different unions and different populations. So we do that across the county. We had approximately 5,200 participants, so for every event that we run, we do take a gauge of attendance, of interest, and kind of gives us an idea of what topics are more popular with the employees, what their interests are, and based on that, we do a lot of the programming from there. We do cover all the different wellness dimensions that you saw previously, so we're not focusing on just one, but we want our staff and our employees to be well-rounded as far as their health is concerned. We know that not everyone's going to be maybe interested in the physical aspect of it, or not everyone's going to be interested in the emotional aspect of it, but we try to give programming so that we can address all issues and all concerns and also all sorts of interest. We want our employees to be interested in the program, and then in turn is going to create a better culture for us as a whole countywide. I'm going to give you a couple of highlights of some of the events that we ran throughout the year. We can go on to the next slide. Let's see. So one of the things that we began doing and has been very effective for us is to present a new employee orientation. So I myself go every 2 weeks during our new hire orientation and present on the program. We believe we want to get the employees as soon as they're starting with us so that they get to know the culture of the program and then they become familiar with all the resources that we have. So I present to them every 2 weeks, so every new hire orientation, we inform them of all the services that they have available and make sure that we get that interest from the get-go with them. We've also been doing a lot of leadership presentations. So when I started going out into the county and doing a lot of my presentations, I realized that a lot of the managers and supervisors were not very familiar with all the resources that we have to offer. And that became very important to us. So we started doing a lot of manager or leadership presentations. We want to make sure that all of our supervisors are aware of all the resources, specifically a lot with the EAP program. We came to find out that a lot of managers were uncomfortable when employees were reaching them and to talk about certain topics, or they were uncomfortable and had to guide people into the EAP program or even some of the other services that we have. So we started doing a lot of presentations for the managers so that they're aware of all the services. We also have a webinar library, so every month we run at least 2 to 3 webinars. They're all based on the health observance that we're covering for the month. So for March, we did nutrition. We did at least 2 to 3 webinars. Those are all offered at a specific time. We try to run them around lunchtime so that employees can take their lunch break and listen to them. However, we know that not everyone's going to be, able to listen to them at a certain time. So we load a wellness library onto our website. And employees are able to go back and just review and listen to the webinars at their own time, on their own leisure. So right now we have about 30-something webinars listed on our website. And we also encourage them to allow their family members to listen to them. We want, the culture of wellness to integrate into their home life also. So we allow, we put up the links and they can just listen with their families. One very important was we ran a webinar on bullying. And this specific webinar, we ran it in the evening. So we actually had the live webinar around 7 p.m. And we encourage our employees to say, we know this is a topic that may be uncomfortable for people to bring up, right? And sometimes the kids don't want to listen to their parents. We know that. So, make this a family activity. Listen to the webinar from the experts. Open up that line of communication with your children. It was very well attended, and we got some great feedback on that. So we run different webinars throughout the calendar year. Like Karen said, we do have a lot of partnerships. We've focused a lot on the very high stress level agencies, so our public safety agencies, our transportation department. We have developed a wonderful relationship with them where, we're going at least every other month to visit them. They're very happy now when they see us. Before it was kind of like, you're just here to tell me how bad a meeting and so forth. Now they're actually glad to see us because they know we come with a lot of useful information and we meet them where they are. That's why I think the program has developed so much and has become so successful, is because we meet employees where they are. We're not telling you, don't eat this or do exactly this. We're giving you resources so that you can little by little start, adapting to healthier lifestyles, and in turn is going to affect your whole overall health. So we've developed some great partnerships with them. With the Employee Assistance Program, I think we skipped a slide. There we go. With the Employee Assistance Program, I have been doing a lot of presentations on this. This has become a very important topic because of all the mental health stigma that Karen mentioned. So we want to make sure that employees are comfortable with knowing that they have these resources available to them, that everything is highly confidential. It's been very important that people know that none of this information comes back to us on an individual basis. And I think that was the biggest fear before when I first started presenting on this. Employees were fearful of what information is going to get back to their supervisors. So we've made it a point to stress the importance of that this is all extremely confidential, but you have all these resources available to them. I have countless stories of employees telling me, wow, I didn't know that. Thank you so much. This was so very helpful. One day we walked into the Department of Transportation, and one gentleman, he was very upset, highly stressed out, and we were able to encourage him right into the EAP program. And then a couple of days later, we got that email saying, thank you so much. You literally just saved me. So these are the, type of things that we see on a daily basis when we're going out into the different departments. We run a lot, of course, the disease management programs are very important to us to reduce those healthcare costs. So we do a lot of programming on diabetes. As a matter of fact, we have one coming up next month. So we do a 4-week series for the employees and for their spouses or dependents on their insurance. They're able to come in for 4 weeks. It's offered through one of our health carriers, so it's offered by diabetes educator experts. They go through a 4-week series, and then from then we lead them onto programs to continue with their own health insurance companies. So we have one coming up in April for general population, and then in May we're actually doing a specific one for the Department of Transportation. So we're taking the department to one of their transportation sites, and it'll be specific for them. Again, we're trying to make it accessible to everyone, and we know that transportation is a population that it's very difficult because of their shifts to get over maybe to the EOB or to any one of our other locations. So we wanted to encourage participation in that, and so we're taking the program specifically to them. We have a lot of stress management seminars, and I'll talk about that in a minute once you see our Health of Services calendar.
I apologize very quickly. I should have said this up front. My colleagues in the Government Operations Committee have a committee session immediately following this. So we did get a little bit of a late start, so I've confirmed with my colleague, Council Representative Navarro, that we're going to push that back to 2:45. But that gives us about 20 or so minutes to go through the presentation and then to go through questions. So if there are highlights you want to make sure we get to, let's make sure we get to them.
Okay.
Thank you so much, and you're doing a fabulous job.
Thank you. So I just want to point out the health observance calendar. So we run our campaigns all based on these national health observances. This is a national calendar. We pull up specific campaigns that we think are important for our employees, and we run all of our events, webinars, and so forth based on these calendars. So this month, we recently kicked off the BurnAlong program. So we had a couple of on-site fitness classes previously, but they were very limited to what locations we could offer, and we wanted to be able to reach all of our employees. So we went to an online platform. Now all of our employees are able to create a free account through the link that we provide for them, and they have access to about 1,000 different fitness classes. Whether they enjoy yoga or boot camp or any type of class, it's all covered under the platform, and they're able to utilize this at their own time. So now we're able to reach all of our employees, not just the specific locations that we held classes at before. We're really hoping that's going to increase the physical activity within our company culture. Moving on to the Virgin Pulse program. So as you know, that Virgin Pulse is our online incentive program for Live Well. Our engagement and our enrollment continue to go up. You will see we started in 2016 at 48%. These figures right here are based on October 2018, and they're also based on not only our departments, but our participating agencies who are on our insurance program. We recently had Virgin Pulse pull up the results without the participating agencies on them, and we were actually at 69% enrollment and 65% engagement. So we are way above the book of business, way above our own goals that we set for ourselves. We know that, the reason participating agencies, have lower numbers is because we don't have direct access to them like we do with our employees. So we do have the figures for you. We have the figures for you pulled out. So you'll see a huge increase when we pull out the numbers from the participating agencies. This is just a list of the different health station locations so people can check in with Virgin Pulse and take either their blood pressure or their weight. Based on these locations, we also get a lot of health data. So this is all validated data. People are going in, taking their blood pressure on a regular basis, and also their weight gives us insight into their body mass index, and from there, we get a lot of health data. So this is just an overview again of the enrollment dashboard. Again, these figures are with the participating agencies on them, but we continue to rise. Engagement continues to look very steady, which is very important. We typically see when a program starts, engagement is very high and it starts dwindling off. For our program, it has remained very steady. So we're very pleased with those numbers. Physical activity dashboard, you'll see, and I'm going to flip over to the next slides because this is all going to correlate together. So the shifts in body mass index, this is very important. We want to make sure that we're taking people in the very high risk categories and moving them into healthier categories. So we see the shift there. You'll see that 53% of high risk people are losing weight since joining the Virgin Pulse program. Very important. We know this will reduce blood pressure, will reduce cholesterol, will reduce the diabetes. So we're trying to get all those numbers from the high risk categories all over into the healthier categories, and we see that data reflected in this. The same for shifts in physical activity. We know the more active a person is, the better, more beneficial it will be for their health. So we see the big jump, 74% of high-risk inactive people are getting more active than normal, and we are way above the book of business. So again, all these numbers are very important to us because It'll help us determine the type of programs that we need to run. And again, we want to shift those people from the higher risk categories into the safer categories as far as our health data is concerned. The same thing goes for blood pressure. You'll see we're making some big changes in the health of our employees just by having them be more active and more engaged in this platform. As Karen mentioned, we are beginning a partnership with our risk management department. And we see, numbers, $62 billion spent in companies in workplace injuries. So we're going to be partnering with them and offering a lot of opportunities to reduce these costs. Also, we see in our health data, you'll see that we have a lot of musculoskeletal issues coming up, and a lot of it is based on sitting for so long and lack of inactivity. So our top health conditions, this is data based on our health carriers, and this is data based not just on our employees, but also their dependents. So that's also important to note. You'll see that most of the categories are cardiovascular, so blood pressure, hypertension. You see diabetes, and you see mental health in two of our carriers. Now, it's also important to note that our carriers do report data differently. So, we try to go and we right here pinpointed the top 5 from each health carrier. But they do report them a little differently. Overall, we see where the higher risk are cardiovascular disease, diabetes, mental health, and the musculoskeletal issues. So those are the bigger campaigns that we run throughout the year for disease management. Okay, our EAP program, our utilization in the EAP has greatly increased, and we are way above the national average. They're very pleased with our participation, and that has been, again, from all the presentations we've done and getting people familiar with the program and trying to erase that stigma of the EAP program. So we've been doing a lot of counseling on that. You'll see that the top 3 issues are psychological, substance abuse, and stress. So these are the top 3 categories that people are reaching out to EAP for. As far as the online guidance resources, you'll see different things: personal growth, marriage relationships, but the top 3 overall were the psychological, substance abuse, and stress. Okay. In this slide, you will see overall year to year our utilization, and it continues to increase. So you see Montgomery County government there in the blue, and it's, as you can see, way above the book of business. And that's our goal, to continue that. We want our employees to know that they have all these resources available to them. And again, I think this is a result of the presentations that we've been doing out in the field.
And last, our program for Montgomery County has been recognized nationally. Lily's received an award for the amazing programs that we have here, and people reach out to us to get ideas in terms of what we're doing, our success, to help them along as well. So I want to thank our coordinator here, our program manager, for the work that she's doing as well.
Really impressive. Council President Navarro is going to kick us off.
Thank you very much for this update. This is a really wonderful update. I would be remiss if I didn't acknowledge, the real hard work of both the previous HHS chair, Leventhal, as well as my previous GEO committee members, because we have worked very hard from the inception to really get this going and making sure that it would be a robust program. And I think that we're seeing since 2015, when we started conceptualizing this program, until now, it's really made a difference. And so I just had a couple of just quick questions. One of the, of course, impetus for this particular wellness program for us was so that eventually we can start tracking data regarding healthcare containment costs. And also be able to, when we renegotiate our health insurance contracts, to see where there were areas that we could strengthen for this program in particular. So number one, I'd like to know if you've seen any data so far in terms of containment costs, and what are the standards usually. I don't remember if there's a number of years that you usually, with programs like this, you can start realizing those kinds of cost savings. And then secondly, one thing that I've been asking for a while, and last time I asked for this was April 18th of last year, was regarding our own COB having, a wellness, a health station. And I know we used to have somebody that was very active, Alexis Reed, which was our liaison, and I'm not really sure who we have now from the council, but I think, for a while we thought, well, let's start in other parts of county government, but this is a place where you have a lot of employees and like to know what is the status. Then Director Stokes said that they were working on it and that we should be, that we would have one shortly, but this was over a year ago. So just want to know what is the status of this, so that we can make sure that our, council office also takes advantage of many of these wonderful services. So first, do we have any data on cost containments for health insurance programs? And
Cost containment, return on investment has been very difficult because of the different insurance carriers, the way they cost things out, and it's different. We are working with a new health and wellness consultant who's helping us merge all the data together, look at it so that we can begin to put some return on investment and be able to report that back to you.
Okay.
But right now, it's
roughly
been-
when that might be?
I'm hoping next year at this time, we should be able to give you a better idea of the return on investment.
Okay.
Typically, it takes about 3 to 5 years to
That's what
start
I
seeing
thought.
the return on investment. So
Right.
we're kind of aligned in that time frame.
We're about the fourth year now, is that what we're
Yeah.
entering? The fourth year, right, okay. Yeah, so then also, just more practical matter, the council building to have a health station, and then I just remember another thing that I was always asking about, especially when it came time to renegotiate our health insurance premiums and offerings, was this notion of including yoga as a covered item. I mean, when I look at the musculoskeletal issues that you were highlighting, the research has shown that yoga can be as effective or even more effective than physical therapy. And so why aren't we negotiating so that yoga could be covered as a, as a benefit?
Yoga was being offered as part of our on-site fitness classes. And again, we were only able to offer those classes at 2 locations. And that is the reason why we went to the online fitness platform. So now you have, like I said, 1,000 videos to choose from, a lot of yoga programming on this platform that everybody
Right, but
will
my
be able
question
to
specifically goes to
Health insurance.
HR, so that when health insurance, when it's time for us to renegotiate our contracts, some of them will cover acupuncture, but they won't cover yoga. And so if we could get employees to take advantage of yoga studios, and have it be covered, and if that's gonna save you money, because then you don't have to go to physical therapy, it is more cost effective. So I know it's something that I've asked in the past, and I wasn't sure if that had been discussed at all.
Negotiate our new contracts with our health carriers, we can include that in there as well.
That would be really useful.
I think that comes up probably in the next year and a half, I believe, we'll go.
Okay,
new-
that would be great. It just seems,
And you will get your health station. I'll make sure that you get your health station.
All
in
right.
the next 6 weeks.
We'll all go use it. Thank you so much.
Part of that was that we're waiting for all the renovations and everything to be done so that we could pick the right location within the building.
Right, yeah, I remember that. Yeah, I think we're pretty
was
much
part of
done.
the holdup.
And Ms. Price, we should follow up on who is our active
I believe
liaison?
Jill Gable is the wellness champion.
Who's that?
Council, Jill
Yeah,
Gable.
Jill Gable and
Oh, okay.
Jean Arthur now, your 2 wellness champions within the city.
Okay, all right, great. All right, thank you.
Thank you. Councilmember Friedson?
Yeah, I just quickly wanted to first echo the comments about all of the great work that has been done by those who are here and our predecessors who are no longer here to really put this program into place and to really make it an emphasis, and also to echo the council president's comments about this not only being about a better quality workforce with a healthier workforce who show up to work more frequently because they're sick less and are generally happier and more productive. And we know that being healthy is a main aspect of productivity. And so this is in the interest of the public as much as it is with our own personnel, but also the cost savings. So I would just reiterate my interest as well in how we can identify what we're saving. I think we all know that having a healthier workforce will lead to cost savings, but it'd be helpful to really be able to quantify it. And I appreciate that. And I just wanted to applaud you. I actually attended one of those very convenient yoga classes. I can't say it was my idea. It was on my chief of staff's birthday, and she's a big yoga, or yogi, I should say. I'm still learning the vernacular. But I did attend. It was on the 4th floor. It was incredibly convenient. I was able to do it between meetings, and it was a very pleasant experience for somebody who's not. I've only done yoga a couple times, and I'm not very good at it. But it was a very accessible. I think it served people at different levels, which I think is really important. Is some of the programming for this wellness, that it's accessible to people of all levels and experiences. And so I just wanted to applaud you. It was convenient, it was a friendly environment, it was easy to access, and it was something that I think is a really successful program. And so I look forward to taking more advantage of that, and just wanted to applaud you for it.
Thank you. We're glad you got a chance to experience that.
Thank you, Councilmember Friedson. Councilmember Glass?
Echoing everything that has been said, I was noticing that in some of the work that you were doing, one of the campaigns was titled "Sitting is the New Smoking." So I would love any tips or tricks for while we're stuck at the dais, hours on end, especially in the upcoming budget season. So anything you want to send me and my colleagues offline would be helpful. But just drilling down ever so more on the cost savings, the one thing that was missing from this packet was the annual investment into this program. Can you tell me what it costs to run this program, at least in FY19?
FY18, we had $340,916 for the program platform. And then we also had for the rewards, where employees the incentives was $518,830.
So around 800 baseline, ballpark? Okay. And has that grown over the last few years?
Over the last 2 years, yes, it has.
Okay.
The more employees we have, then the cost will go up because we pay per participant.
Great, thank you.
Councilmember Rice?
Well, thank you very much. So I have a question for you about, do we have a way of tracking the number of people who are actually utilizing the discount program when it comes to all of our fitness facilities throughout the county?
That program is covered through the recreation department. You're assuming you're talking about the gyms, correct?
Right, well, I think it's through our health insurance, though, because it's a relationship with health insurance, because I get LA Fitness for $25 a month.
Yeah.
Right, and the reason why I ask that is because a lot of people, I used to, when I had a Max, used to track my stuff through there, but it became multiple between so many different things. I have my Apple Watch. I know they link together, and now I just linked it to my phone to update it. But I know a lot of people aren't doing that. I think that you're missing a large portion of our county government community, because I wasn't linked. And I just linked again now, and I go to the gym. Evan and I were just talking about how he goes to the gym, and I go to the gym. And I know you don't have either of us tracked. And so I can only imagine how many more people are actually living healthier lifestyles, working out and doing those kinds of things that we're just not tracking. And so I think by utilizing some of the other and trying to get some of that information about what other people may be doing, just as, Councilmember Navarro said, I can just imagine the number of folks who are in yoga classes, but who aren't linked up to your system. And so they're doing things, but we're missing that aspect of it too. And I think at the end of the day, it's through all of the different things that we've done, through the great work that you've done in setting these up. Because I'm going to tell you, before I came to county government, I had been a member of LA, but then it was Bally's at the time. And then it dropped my membership. It was too expensive. And then when I found out that I could have it for $25 at the time and then no sign-up fee, I was like, great. And I've been with LA Fitness for almost 4 years now with the new resurgence. And I mean, 3-4 times a week, I run into county employees all the time, police, fire, other folks from Montgomery College and from MCPS. I mean, so there are a lot of people out there that are utilizing our resource. And so I'd really like to see us be able to try and drill down on that. So just that one for you. Now, when it comes to mental health, and I have a little bit of a concern here, and this is something I shared with Director Stokes before, and something that I hope that is a part of our new negotiation with the contract we can start to address. The challenge with mental health, and this is a huge challenge amongst all, is that we provide the repayment after a person is already paid. And so essentially you're reimbursing folks who are paying for mental health services. And so what happens is unlike a doctor's office where you have your standard coverage, and these are network providers, the problem is for folks who don't have $200 to shell out, right? Even though they want to get that coverage for their child and take them there, they don't have the money up front to do it. And so it really becomes a challenge for folks when trying to decide whether or not to put food on the table or send my child to speak to a therapist, and it's not getting done. I can tell you, when people are faced with that kind of dire circumstance between paying rent and paying for a mental health therapist, even if they're going to eventually get it back at some point, that doesn't matter at the time because they just don't have that kind of cash lying around. And so I really would like us to see, we do a great job of talking a lot about the seriousness and importance of mental health, but until mental health actually becomes something where you actually have that coverage and it's affordable up front so that folks aren't paying out of pocket and then being reimbursed, it's going to continue to be a challenge, and we're going to see it more in our socioeconomically impacted communities. You're going to say something later.
Can I add something? The insurance carriers do offer mental health, so if you use your insurance, you would just be paying your copay. So they do offer those services to all of the insured, their dependents. You would just make that appointment in network, and you would just pay your copay.
A lot of payments, what you're referring to is probably people going out of network, but all three carriers do provide mental health services as well as services through AAP, which are no cost to the employees.
Services through which one? Because we've had
EAP,
we've
so
had
the
folks
on-site
who've
program.
contacted us because they're also, when it comes to pediatric, because there are different disciplines that are there, and so when it comes to pediatric, they weren't able to find, the only ones they were able to find were ones to which they had to pay out of pocket up front. So I'd love to talk with you more about that and analyze where they are, who they are, and what services are provided, because I'm not familiar with those right now.
Yeah.
So, okay, thanks.
Thank you. Councilmember Katz?
Thank you very much, and I am going to be extremely brief, but congratulations and thank you for a very nice presentation. I was here when it was done last time, and obviously you've had great success. Please remind me again what Book of Business actually stands for. What does that stand for?
So the average of, let's say, a corporation similar to us, so other local governments, what their participation would be. We compare it to their data and see, kind of gauge where we're at.
It's interesting. I just had never heard that term. And to the mental health for the maybe we can come up with some sort of rotating fund, or at the very least, educate people that what funds are available and how they can utilize it. Because if $200 is standing in the way of someone getting a lot of help that they need, $200 really is something that we should try to figure out how to help out on. And I just say that we could probably pay for this fund if we could get the video of you doing yoga. That's right. That's right. Thank you very much.
I love that.
No. I was in the back intentionally so that no one could see me.
So
On YouTube somewhere, I'm sure.
So I just had a few comments to bring this home. First of all, once again, thank you for all of your efforts. And I do want to acknowledge the incredible work of the previous council. On all of this, I had the opportunity to observe from afar and was so impressed with the leadership on so many different levels, which segues to leadership here is important. And so I hope the county executive commits to continuing this important work, and I hope that the next director of the Office of Human Resources picks up where we have been, and that be among the questions that we ask of whomever the next director is. And so if you could please take that back to the executive branch and let them know that this council, is fully committed to this project moving forward, and we hope that this administration will be as well. 3 final points. One area of concern for me is screen time, because we are more and more and more attached to our mobile devices, and we have a constituency now that demands and certainly deserves responses as quickly as possible. And those barriers and limitations among county employees often vary depending on who your manager is. And so, and it has a health and wellness impact. And so the degree to which we can be consistent in how we administer things like email and communication policy, social media policies, so that we have some consistency across the board. It would help managers, but it would certainly help employees and has a direct impact on overall health and wellness. And if we can minimize that screen time to something more manageable, I think that would be important. And then I think another area that is a potential for growth is a more direct connection to our National Park Service, our State Park Service, and our Maryland parks. We're encouraging pediatricians now to literally prescribe outdoor play to children, and I think there's an opportunity for us to partner with the Maryland State Park System as an example to help underwrite the cost of access to Maryland State Parks. I believe it's $50 for a family for the entire year, to get people out into Mother Nature and experiencing those things, which I think will have health and wellness benefits. And then finally, I have observed that the key to the successes of programs like this is that management fully buy in. And so encouraging managers to encourage their employees is a critical component to this. And so I know we've quantified success in the actual delivery of the service itself. If we can quantify the success among managers who are doing a better job than others in encouraging this within their teams, I think would send a positive message and provide some positive competition out there to get people engaged.
Absolutely. And
yep.
to that point, we see that within the enrollment of each business unit. We see where the leaders that are heavily involved within the wellness program, their enrollment rate is, wonderful. We have departments that are at 100% enrollment rate. So we do see the difference there.
And I think this could be included within the dashboard of outcomes as we're looking through how to use county stat, and I know that's being revamped now under our new chief administrative officer, but I think these benchmarks should be embedded across the board. Thank you very much for coming today. We appreciate the presentation. And we are now going to adjourn this part of the joint committee session and go directly into government operations. Thanks a lot.
For your
Thank you,
time.
Tom.